Well, now we've got you through the transplant and we're looking at the after hospital when you're discharged. So what will happen is you'll be going home, most likely. Very few people go to rehab. If you need that, that will happen. But if not, you're going to be discharged to home. You're going to be on new medications that you're going to be taking every day, twice a day for the rest of your life. You're going to be given an appointment to come back to the clinic. And this happens all the time, once a week in the beginning. Sometimes it can be twice a week. We'd expect that you'd come to the clinic, which is over at 165 Cambridge Street, that you'd show up early in the morning, about 7:30. You get some blood work drawn, and then you're going to be meeting with one of the nurses after a 4-hour period of time and along with meeting with one of the doctors, one of the surgeons. The frequency of these visits over time can decrease, and again, you won't be able to drive, you won't really be able to take public transportation right off, so this is when you're going to really have to rely on that support person to help you out. When you come to these meetings, you're going to be bringing your medications with you, and you're going to be instructed to the medication called Prograf. That's your primary immunosuppressive medication. You're going to be given instructions of not to take it that morning because we want to get your blood work and see how well your liver is doing, and should we increase that medication or decrease that medication. What we want to make sure is that you know when you're at home, if you should need to speak with somebody in the transplant clinic, that you should give us a call. You should call if you have a fever that's greater than 100.5. You should call if you have questions about your medicines. We certainly don't want you to run out of any medication. If you need refills, and we need to hear from you. All of this is all new to you. It's new to your support person, and we're here to help you out as best we can. The medications, we can't state emphatically enough how important they are. They're your lifeline. The surgeons have taken out your old liver, they've put in a new liver, and now it's the medication that makes sure it allows your body to have that liver stay where it belongs and work well. The primary medication that we use for immunosuppression is called Prograf or tacrolimus. You might hear it called FK506. It's all the same drug. We tend to use that and the drug Cellcept. Those are our two primary drugs. People can be on prednisone. They're usually on that while they're in the hospital, and then most of the time that's taken away before they go home. Sometimes people will be put on a different drug called Rapamune. That's not for all patients. I think if you focus on two, it's going to be Prograf and Cellcept. And again, keeping in mind these drugs are lifetime. We don't want you to miss them. We don't want you to run out of medication, and we're all human. We realize that after you're on a medication for a while, it gets hard to remember to take those, but that's going to be your job. The things that these medicines can cause that we watch out for is people can have high blood pressure. If a person is coming into liver transplant and they have diabetes, we know if they're on pills for their diabetes, they tend to need to be on insulin afterwards because these medications can cause the blood sugars to be higher. The medications can also cause kidney function to be a problem, so we want to monitor that. That's why we have you come to the clinic, you get your blood work done, the nurses look at it, the physicians look at it, and then we can make changes according to what needs to be done. The medications can be very expensive. This is where you want to be sure that your insurance company is involved right from the get-go. Sometimes we'll have patients, what you could do is you could call your insurance company and let them know that you're going to be taking certain medications. We give you a list of these medicines, they're right in your pamphlet, and you could find out, what would be your copay so that none of this would be a surprise for you. Along with the medications, what we're watching for is what you heard a little bit earlier is about rejection. Rejection is not something, most people are a little afraid of that word, but really, like you heard earlier, it really is telling us that the body is recognizing that that new organ is not yours, that it's not self. And we treat that with more medication if needed. We tend to find that people don't always feel rejection. They tend to maybe over time realize that their labs are abnormal. That's why we want you here often, at least weekly. Some people will have a fever, so if you should run a fever or you feel nausea or vomiting, or if you get some tenderness over where that transplant, they call it a graft, where that new liver is, or certainly if you look jaundiced, you want to call the center right away. But really how we diagnose it primarily, what we're watching all the time, is going to be the liver function tests that you have drawn either locally and have them sent to us, or you have them drawn when you're here. If they're elevated, don't be shocked if the physicians want to do a liver biopsy. That's okay. They just take a little bit of the liver and they'll take a look at it, and if it's rejection, they want to treat it. And they primarily treat that with giving you more anti-rejection medication. Sometimes they'll give it to you through an IV, and sometimes they'll give it to you orally. I think the more of the worry is we look at people if they over time either don't take their medicines correctly or don't take them at all for certain reasons. And the primary reason people don't take it is because these medicines can cost quite a bit. And we want to make sure that you have plenty of medication and that you don't run into a risk. And that's why we want you to keep in touch with the insurance companies and the financial coordinators. Going along either rejection or infection, what we want to make sure is once we've been transplanted a person and we've put you on immunosuppression, that's backing up your immune system. And also what we want to make sure is when it's backed up a bit that you don't end up with an infection. People that are put on the liver transplant wait list will also meet with our infectious disease transplant doctor, Dr. Cotton, and her team. And they do a great job with education. They're going to make sure that they talk to you about what animals are in your household, because certain animals can transmit disease after liver transplant. They're going to want to make sure that you have your vaccinations. They're going to instruct you not to be eating foods that are raw meat, such as kibe or sushi. Those things after liver transplant can be a problem. You're going to be given medications to prevent infection. So what we do is we give you medicine to suppress your immune system. When I was telling you earlier, Prograf and Cellcept primarily. And then we give you a couple of medications to hopefully prevent infection. And you're on those for a few months, Cellcept and Bactrim. When you come into your infectious disease appointment, you should bring with you, if you have it, a list of what vaccinations you've had if we don't already have them in our system. The things that you're going to want to hear or want to know about is when can you go on public transportation, because you can't do that right off. What pets can you be around? What should you do for hygiene? What if you're a farmer or you like to fish? Those are all the things that you need to learn more about, and you'll get that when you meet with Dr. Cotton and her team. Sometimes after liver transplant, people can feel a bit depressed or down. It seems like there's a lot of excitement to get you to transplant. There's a lot of positivity, and then all of a sudden the transplant happens and there's not so many people around, and people can feel sad or depressed. It's not something we see often, but it can happen. It can be symptoms of PTSD. If you have those feelings, we would certainly get you to work with the transplant psychiatrist, or we'd get you to work with some of the counselors, but we would want you to let us know that.